What is a pressure ulcer? How can it be prevented and treated? These questions were probably lingering in your thoughts as you were getting ready to attend this session. According to the Department of Human and Health Services, the prevalence of pressure ulcer development is highest among the older adult population. It has also been estimated that 70% of pressure ulcer development occur in patients 70 years of age and older. As a wound care nurse for 2 years, I have seen and treated elderly patients with pressure ulcers more than in any other age groups. As we go on, I hope that those lingering questions are still in your thoughts, because today I will be discussing what pressure ulcer is and ways to prevent and treat it. But let's first start with the first question. What is a pressure ulcer? According to the textbook Foundations of Nursing, a pressure ulcer, also known as a bed sore, is a skin breakdown caused by the sufficient pressure on the skin, causing blood vessels in that area to collapse, resulting in underlying tissue death. Besides the unrelieved pressure, shearing force, which happens when tissue layers of skin slide on each other, and friction, rubbing against another surface, are also factors to the development of pressure ulcers. Pressure ulcers mostly occur on bony prominences, such as heels, ankles, knees, elbows, shoulders, sacral area, ischial area, spinal area. It also occurs with the use of a cast, drainage tubes, and oxygen tubing. Risk factors for development of pressure ulcers include age, medications, medical conditions such as diabetes, kidney failure, and heart failure, circulatory disturbances, incontinence, poor mobility, smoking, sensory deficit, and poor nutrition. The Foundations of Nursing textbook also describes the 6 categories of pressure ulcers. The first category is suspected deep tissue injury. This is a suspected deep tissue injury. During this stage, affected area is still intact, but appears with localized purple or maroon discoloration. It can also be a blood-filled blister. Affected skin area may appear firm, mushy, warm, painful, or cool. As treatment, the National Pressure Ulcer Advisory Panel, or NPAUP, advises the use of moisture barriers to keep the skin integrity. You can use Dermamed cream as an example. The second category is stage 1 pressure ulcer. This stage is characterized by intact skin with non-blanchable redness. This is an example of a stage 1 pressure ulcer. In short, the affected area of skin does not turn white or purple when you press on it. With this stage, the NPAUP advises the use of moisture barrier cream as well to keep the skin intact. The third category is stage 2 pressure ulcer. The website Highmark Blue Shield characterizes this as a partial thickness skin loss, involving the dermis, epidermis, or both. It may appear as a blister, fluid-filled blister, abrasion, or a skin tear. The treatment for this stage may include wound debridement using Santyl ointment. In other words, dead tissue is removed to improve the healing of the healthy tissue. Besides wound debridement, hydrogels and Duoderm patch are also recommended for wound healing. The next category is a stage 3 pressure ulcer. This is a stage 3 pressure ulcer. In this stage, full thickness tissue loss has occurred and subcutaneous fat is visible, but bone, muscle, tendon are not exposed. For treatment, the NPAUP suggests the use of wound debridement using Santyl ointment or sharp device, alginates, and chloroform. The fifth category is a stage 4 pressure ulcer. This is a stage 4 pressure ulcer. Treatment include, The fifth category is stage 4 pressure ulcer. This is a stage 4 pressure ulcer. This type is characterized by full thickness tissue loss with exposed bone, tendon, and muscle, and often includes undermining and tunneling. Treatments include wound debridement using Santyl ointment or a sharp device, negative wound pressure therapy, alginates, and collagens. The last but not the least is unstageable pressure ulcer. This is how an unstageable pressure ulcer looks like. Unstageable pressure ulcer involves a full thickness tissue loss, and wound base is covered with necrotic or dead tissue or slough or damaged tissue, which can be seen as gray, green, tan, or yellow. During this stage, wound debridement is required first to remove dead tissue and expose the healthy tissue. Once healthy tissue is exposed, collagens, alginates, and negative wound pressure therapy may be applied for treatment. Patients with active and recurrent pressure ulcers need to be seen by a wound care specialist to track down the healing process. Also, appropriate treatments as ordered by the physicians have to be followed to speed up the healing process. As you can see, pressure ulcer is a very serious issue. So how can we prevent them? According to mayoclinic.org, pressure ulcers can be prevented by constant turning and repositioning, quitting smoking, healthy diet, active physical activities, proper skincare, and taking care of underlying medical conditions. The occurrence of pressure ulcers is truly a very serious case, but there are many ways to prevent this from happening and treating it to bring back skin's integrity. I hope that through this session, you will be able to anticipate the risk factors and begin to incorporate the multiple preventive ways to lessen the occurrence of pressure ulcers in all age groups. Thank you.